Have you ever noticed a small growth on your neck, eyelid, chest, or back, and wondered whether it was simply part of aging or something you should not ignore? Many skin bumps are completely harmless, but the problem is that very different conditions can sometimes look surprisingly similar. A harmless growth may resemble a wart, a clogged pore, or even a form of skin cancer. And attempting to cut, burn, freeze, or squeeze the wrong lesion at home can lead to infection, scarring, or a dangerous delay in diagnosis. In this video, I will walk you through 9 common types of skin growths, explain how they typically appear, and show you why some should be left alone while others deserve professional attention. My name is Dr. James Carter. Before we begin, remember that photographs and general descriptions cannot confirm a diagnosis. A lesion that grows rapidly, bleeds repeatedly, develops an open sore, changes noticeably, or simply concerns you should be examined by a qualified medical professional. Let's begin with one of the most familiar growths, the skin tag. A skin tag is usually a soft, flexible piece of tissue that hangs from the surface by a narrow stalk. It may match your normal skin tone or appear slightly darker. Most are only a few millimeters across, although some gradually become larger. Skin tags favor areas where skin repeatedly rubs against skin or clothing. Common locations include the neck, armpits, eyelids, groin, and the folds beneath the breasts. They become more common with age and may run in families. They are also seen more frequently in people with obesity or insulin resistance, although having a skin tag does not by itself mean that you have diabetes. In most cases, a skin tag is benign and does not need to be removed. Treatment becomes reasonable when it catches on jewelry or clothing, becomes repeatedly irritated, twists on its stalk, or causes a cosmetic concern. A clinician may remove it by carefully snipping it, freezing it, or using heat to seal the base. The appropriate method depends on its size and location. What you should not do is assume that every dangling growth is a skin tag and attack it with a home removal device. Moles, warts, and several other lesions can be mistaken for skin tags. Improper removal may cause bleeding, infection, burns, or scarring. Skin tags tend to be soft and mobile. But another extremely common growth often looks as if a rough piece of wax has been pressed directly onto the skin. That is where we will continue next. The waxy growth I just described is called a seborrheic keratosis. You may also hear people call these age spots, wisdom spots, or growths of aging, although they are not the same as flat sunspots. Seborrheic keratoses may be tan, brown, gray, or nearly black. Some are smooth, while others are rough, crusted, or wart-like. Their most recognizable feature is a stuck-on appearance, almost as if the growth were sitting on top of the skin rather than developing within it. These growths become increasingly common with age, and genetics appears to influence how many a person develops. Sun exposure may contribute to some cases, but they can also appear on parts of the body that receive little sunlight. Although seborrheic keratoses are generally benign, appearance alone can sometimes be misleading. A dark or irregular growth may resemble a wart, a precancerous lesion, or occasionally melanoma. This is why a new lesion should not automatically be dismissed simply because it looks like an age-related growth. Treatment is unnecessary unless the area becomes irritated, catches on clothing, or bothers you cosmetically. Depending on its thickness and location, a dermatologist may freeze it, gently scrape or shave it away, or use another controlled procedure. Results are often very good when the growth is small and superficial. A thicker lesion may leave temporary discoloration, a lighter or darker mark, or occasionally a flat scar. Trying to scrape it off at home also creates unnecessary risks, especially when the diagnosis has not been confirmed. Now let's move deeper into the skin. A dermatofibroma is a firm, scar-like bump that commonly appears on the lower legs, although it can develop elsewhere. Its exact cause is not always known, but some arise after minor skin trauma, an insect bite, or irritation around a hair follicle. Unlike a soft skin tag, a dermatofibroma often feels fixed and solid. It may be pink, brown, reddish, or darker than the surrounding skin. Some are painless, while others become itchy or tender when rubbed or bumped. Because this growth extends into the dermis, superficial treatments such as routine freezing may not remove it completely. Surgical excision can remove the entire lesion, but it replaces the bump with a surgical scar that may be more noticeable than the original growth. For that reason, most confirmed dermatofibromas are best left alone unless they are painful, repeatedly irritated, changing, or diagnostically uncertain. But what if the bump is not brown or firm? What if it looks like a tiny white bead trapped beneath the surface and refuses to pop? That common problem is frequently mistaken for acne, and we will examine it in the next part. Those tiny white bumps that refuse to pop are often milia, and they are not the same as whiteheads. Milia usually appear as small, firm, pearly white or pale yellow bumps just beneath the surface of the skin. They are especially common around the eyelids and cheeks, although they can develop almost anywhere. They are generally harmless and do not usually cause pain, redness, or inflammation. The reason milia are so often confused with whiteheads is simple. From a distance, they can look almost identical, but underneath the surface, they form in very different ways. A whitehead develops when oil and dead skin cells collect inside a hair follicle and block its opening. Milia, however, are tiny cysts filled with keratin, a protein naturally found in your skin. Because a milium does not necessarily have a direct opening to the surface, squeezing it like a pimple usually accomplishes nothing. In fact, repeated squeezing may cause more trouble than the original bump. The skin around the eyes is particularly thin and delicate. Pressing it with your fingernails or piercing it with an unsterilized needle can cause bruising, infection, inflammation, dark marks, or a permanent scar. Milia can affect people of any age. Some appear without an obvious cause, while others develop after the skin has been disrupted by a burn, blistering rash, injury, or resurfacing procedure. Certain heavy creams or ointments may also contribute in people who are already prone to them, but a single product is not always responsible. Some milia disappear naturally, especially in infants. In adults, however, they may remain for months or even longer. Gentle exfoliating ingredients or a retinoid may reduce the formation of new milia in appropriate patients, but these products must be used cautiously, particularly around the eyes. Strong acids and aggressive scrubbing will not safely force an existing cyst out and may only damage the skin barrier. When removal is necessary, a trained professional can create a very small opening above the milium and carefully extract the keratin. In some cases, removing the cyst wall as well as its contents may reduce the chance of that specific bump returning. Even then, a new milium can still develop nearby. So if a white bump does not behave like acne, do not keep squeezing harder. It may not be acne at all. The next condition can also be mistaken for a clogged pore, but it deserves even greater attention because in some cases, it can resemble a common form of skin cancer. The next growth is called sebaceous hyperplasia. It is a benign enlargement of the sebaceous glands, the microscopic structures that produce the oil known as sebum. These bumps commonly appear on the forehead, cheeks, or nose, where oil glands are especially abundant. They are usually small, smooth, and skin-colored, pale yellow, or slightly pink. One of their most recognizable features is a shallow depression in the center, often surrounded by tiny yellowish lobules. Sebaceous hyperplasia becomes more common with age and is often more noticeable in people with oily skin. Although it may resemble a blocked pore, it is not simply a pocket of oil waiting to be released. The gland itself has become enlarged. This is why squeezing the bump usually does not remove it and may instead cause irritation, bleeding, or scarring. Skincare products may help manage oiliness and support the general condition of the skin, but they are unlikely to make a well-developed bump disappear completely. If treatment is desired for cosmetic reasons, a dermatologist may use carefully controlled electrocautery, laser treatment, cryotherapy, or another procedure selected for the patient's skin and the size of the lesion. The treatment must remain precise. Going too deeply can leave a depression, scar, or area of altered pigmentation. This is another reason home-burning devices, needles, and strong acids should not be used. The most important issue, however, is not cosmetic treatment. It is making sure that the diagnosis is correct. Sebaceous hyperplasia can occasionally resemble basal cell carcinoma, the most common type of skin cancer. Both may appear as a flesh-colored or pink bump, and both can sometimes show a central depression or visible blood vessels. An experienced dermatologist can often distinguish them by examining the lesion closely with a dermatoscope, but a biopsy may be necessary when the appearance remains uncertain. Pay particular attention to a bump that steadily enlarges, bleeds with minimal contact, repeatedly forms a crust, develops an open sore, or fails to heal. These signs do not automatically prove that the lesion is cancerous, but they are strong reasons to arrange a professional examination rather than attempting to treat it yourself. The safest rule is simple. If a growth is new, changing, or does not match the usual pattern, do not rely only on an online photograph. In adults, a smooth bump with a central depression may come from an enlarged oil gland. But when several similar pearly bumps appear on a child, especially around the skin folds, the cause may be completely different. It may be a contagious viral infection, and that is what we will discuss next. The contagious condition I mentioned is Molluscum contagiosum. It often affects children, although teenagers and adults can develop it as well. Molluscum usually appears as a group of small, smooth, firm bumps. They may be pearly white, pink, or the same color as the surrounding skin. Like sebaceous hyperplasia, each bump often has a tiny depression in its center. But molluscum lesions are more likely to occur in clusters and may spread from one area of the body to another. In children, they commonly develop in warm skin folds, such as the armpits, behind the knees, around the groin, or inside the elbows. They may also appear on the trunk, arms, face, or other areas that have come into contact with the virus. Molluscum contagiosum is caused by a virus that spreads through direct skin contact. It may also be transmitted by shared objects such as towels, clothing, or sports equipment. A child can spread the bumps across their own body by scratching one lesion and then touching another area. The bumps themselves are usually not dangerous. In a healthy child, the immune system will often recognize the virus and eventually clear the infection without treatment. However, that process may take many months and occasionally longer. The problem is that molluscum can become itchy. Some children also develop an irritated eczema-like rash around the bumps. When they scratch, the skin may become inflamed or infected, and the virus can spread more widely. Whether treatment is needed depends on the number and location of the lesions, how uncomfortable they are, and the health of the patient. A clinician may recommend observation when the bumps are limited and not causing problems. In other cases, treatment may help reduce discomfort or limit continued spread. One option used by medical professionals is cantharidin. This substance was originally derived from blister beetles and is designed to create a controlled blister beneath the treated lesion. As that superficial blister heals, the molluscum bump separates from the skin. Despite its unusual origin, cantharidin is not a home remedy. It must be applied in a carefully measured amount by a trained professional. Incorrect use can cause excessive blistering, burns, pain, or injury to healthy skin. Freezing, curettage, and other treatments may also be considered, but each has potential discomfort and side effects. No treatment guarantees that every bump will disappear immediately, and new lesions may already be developing before they become visible. Molluscum originates from a virus. The next two bumps have a completely different source. Their blue, purple, or bright red color comes from blood vessels within the skin. The first of these vascular lesions is called a venous lake. A venous lake is usually a soft, compressible spot that appears blue, dark purple, or almost black. It is most often found on the lower lip, although it may also develop on the ear, face, neck, or another area that has received years of sun exposure. The color comes from blood collected within a dilated vein close to the surface. When a clinician gently presses the lesion with a clear instrument, the color may fade as the blood is temporarily pushed out of the vessel. Once the pressure is released, the color returns. Although this response can provide a useful clue, you should not use it as a home diagnostic test. A blue or black spot may also represent a mole or another pigmented lesion, and not every suspicious growth behaves in a predictable way. A confirmed venous lake is harmless and does not need treatment. It usually remains in place and may slowly enlarge over time. If it frequently bleeds or creates a cosmetic concern, treatment options may include a vascular laser, electrocautery, cryotherapy, or another procedure that closes the dilated vessel. Because the bump contains blood, puncturing or cutting it at home can cause significant bleeding and should be avoided. Another very common vascular growth is the cherry angioma. Cherry angiomas usually look like small, smooth, round bumps that range from bright red to dark red, purple, or occasionally almost black. They most often appear on the chest, abdomen, back, arms, and shoulders, but they can develop almost anywhere. Unlike a venous lake, which usually involves one enlarged vein, a cherry angioma consists of a small collection of blood vessels. These growths become more common during adulthood, and genetics appears to influence how many a person develops. Finding several cherry angiomas does not usually mean that something is wrong inside your body. In most people, they are simply a common feature of aging skin. They do not require removal unless they bleed repeatedly, become irritated, or bother you cosmetically. A dermatologist may remove one with electrosurgery, cryotherapy, or a vascular laser. These procedures treat existing angiomas but do not prevent new ones from appearing later. Occasionally, a cherry angioma can clot, darken, or resemble a different type of lesion. A spot that grows rapidly, bleeds repeatedly, has an unusual shape, or looks noticeably different from your other red bumps deserves medical evaluation rather than automatic reassurance. Venous lakes and cherry angiomas are not contagious. The final growth in this video is very different. It can spread between people, resist treatment for months, and make every step feel as though a small stone is trapped beneath your foot. In the final part, we will examine warts and the clues that distinguish a plantar wart from an ordinary callus. The final growth is the wart, which develops when certain strains of human papillomavirus infect the outer layers of the skin. These are skin-related strains of HPV and should not automatically be confused with the strains more commonly associated with genital infection or cancer. Warts spread through direct contact and may also be transmitted through contaminated surfaces. The virus enters more easily through small cuts, cracks, or areas of damaged skin. Warts can develop in many shapes, but plantar warts occur on the soles of the feet. Because your body weight constantly presses against them, they may grow inward beneath a thick layer of hardened skin. Walking can then feel as though a pebble is trapped inside your shoe. A plantar wart is frequently mistaken for a callus. Both can appear thick, rough, and uncomfortable, but there are two useful differences. First, a wart may contain tiny dark dots. These are not dirt or roots. They usually represent small clotted blood vessels inside the lesion. Second, look at the natural lines of the skin. With a callus, those lines generally continue across the thickened area. A wart tends to interrupt or push aside the normal pattern because it is a viral growth developing within the skin. These clues can be helpful, but they are not perfect. A painful or unusual lesion on the foot should be professionally assessed, particularly if you have diabetes, reduced sensation, poor circulation, or a weakened immune system. Some warts eventually disappear as the immune system recognizes the virus. Others persist for months or years. They can also spread to nearby skin or to another person, which is why treatment is often reasonable when a wart is painful, multiplying, or interfering with walking. One common home treatment is salicylic acid formulated specifically for warts. It gradually removes layers of infected skin and must usually be applied consistently over many weeks. Ordinary face cleansers or low-strength acne products are not designed to treat a thick plantar wart. Follow the product directions carefully and protect the surrounding healthy skin. Do not cut deeply into the wart or make it bleed. People with diabetes, neuropathy, or circulation problems should speak with a healthcare professional before using an acid treatment on their feet. If home care fails, a dermatologist or podiatrist may offer cryotherapy with liquid nitrogen, controlled removal of thick surface skin, prescription medication, electrosurgery, or laser treatment for selected resistant cases. More than one session may be necessary because removing the visible tissue does not always mean the virus has been completely cleared. The large number of available wart treatments tells us something important. No single method works quickly for everyone. Patience and consistency are often essential. As we finish, remember the central lesson of this video. A bump's color or shape may provide clues, but it cannot always reveal the full diagnosis. Avoid cutting, burning, freezing, or squeezing a growth unless you know exactly what it is. Seek medical attention when a lesion grows rapidly, changes noticeably, bleeds without a clear reason, develops a persistent sore, becomes increasingly painful, or simply looks different from your other spots. Most common skin bumps are harmless. The safest approach is not panic, but informed observation and professional evaluation when something does not follow the expected pattern. I'm Dr. James Carter. If this video helped you understand your skin more clearly, subscribe to the channel and leave a comment telling me which skin condition you would like me to explain next. Thank you for watching.